Hello and welcome to Navilas Masterclass. My name is Léonard Coulibaly. I'm a resident at the Technical University Hospital in Munich, and I'm very happy to give you a short overview about retinopexy in the far periphery using the Navilas laser system, especially using contact-free laser. These are my financial disclosures. In clinical practice, the Navilas laser has replaced our conventional laser. So there are a few residents who still prefer the conventional laser, but mostly as they have not been trained on the newer laser. Everybody else has switched, and in everyday practice we use the Navilas laser. The advantages of the Navilas laser can be summarized in general that it's a very effective tool to place the laser spots around specific retinal lesions with tight spacing. So what you can do basically is to adjust the spaces between each spot that you want to set, and you can make them as tight as possible, and you can do very precise patterns. It has a very high safety due to the easy orientation. Where's the macula, where's the optical nerve head, and you have these safety zones that you can place just to be sure that you don't laser anywhere that you don't want to. It also offers a way to automatically document what you want to do or what you have done, where it automatically calculates everything that has been done and that has been lasered. And what we have also seen that it's an easy teaching tool, not only for students and residents, but also for patients. We can show them what we want to do. We can show them what we have done so far. And that's been quite useful in everyday practice. It's very transparent and traceable for these patients. Once you have a routine in doing this, it's also a much shorter treatment time if you get used to setting up the laser and preparing the patient. Now let's talk about the advantages of the contact-free laser. So for the patient, of course, it's less pain during and after the laser treatment, as there's no damage to the cornea. It's a shorter treatment time for large defects. So if you need to do a lot of lasers, you can do them much faster using the Navilas system. For the user, again, it's easier as it's shorter, and the treatment is less complicated, it's less messy. You don't have to use one hand to hold the glass and the other hand to work the laser. So you can do everything with two hands and have a good look at the patient as well. It's possible even in the far periphery with a little bit of practice. So I'm talking about contact-free laser, which can be a little bit difficult in the beginning, but as you get used to it, you mostly reach all of the peripheral lesions. I will show some examples in a few slides. Another advantage that we've seen in daily clinical practice was a new way to approach very difficult lesions. So we'd first try the Navilas laser with the contact-free option just to see if it's possible. And if we don't manage to get around the lesion, we can do an escalation to a vitrectomy or cryopexy on the same day. With the conventional laser, using a contact glass would damage the cornea, would render the visuality during vitrectomy or cryopexy much more difficult, and maybe would have been postponed. So now we can do this in one day. So this is something that we've learned ourselves while using Navilas laser system in clinical practice. Let's come to our first case. It's a nightmare case for the residents. Peripheral retinal laser in a small child. We have an 8-year-old patient with a vitreous traction and a round retinal hole. Of course, the challenges in children, these patients are restless, the eye moves a lot, maybe the positioning is suboptimal, the laser table might be too high, you might have to adjust something, the patient might be very anxious, you want to avoid causing a trauma, you have the parents as well that are very worried, you're working with lasers, so they want to know what's happening. And what we also have to think about is the lesion size. It can grow, so we want to be very precise on where we will laser and where we don't want to laser. And the Navilas system has shown to be very, very easy to handle children, because we can show them what we want to do. It's less traumatic as there's no contact glass that needs to be put in the eye. The parents as well, we can show them exactly what we want to do, where we're going to do it. So this has been the result for the Navilas. Here you see it inside the system, where we decided where we want to put the spots around the lesion. We chose to do just 2-row grid as it's a child, and we anticipated that these lesions would grow a little bit more. Also, you have the safety zones that you can see here. Exactly. This is the patient 3 weeks after laser treatment. In the infrared image, we can clearly see the spots are quite well developed, and we're sure that we circulated around the lesion. This second case is retinal laser up to the ora serrata. We have here 2 retinal holes pretty far in the periphery. What you see here, the laser spots were done with the conventional laser, and was a resident who'd come up and be like, oh, I tried to laser these holes, but did not manage to get around them. So could we try to do it with the Navilas system? And here you see how the Navilas laser worked. In this case, I used a contact lens because I just wanted to show you how the lesion would clearly be visible. It works also without the lens, but just for better visualization, I used it here. And as you see here inside the system, there are spots that are on the periphery of these holes. So we managed to get around the lesion. So case 3 is a little bit of an unconventional case, prophylactic 360-degree laser barrier in the fellow eye of giant retinal tears. So there have been 2 publications, or there have been a few publications, but 2 quite recently, that suggest that prophylactic laser treatment in the fellow eyes of giant retinal tears might be quite useful, as these patients are less likely to develop a macular off retinal detachment. So these are these huge retinal tears. We're not talking about the tears, we can't laser them, but we can laser the fellow eye. It's like a prophylactic treatment. If you do it with the conventional laser, it's quite challenging, as you need to really be careful not to laser somewhere you don't want to, as it's quite hard to orient yourself. But with Navilas laser system, it's very, very easy. You have the safety areas, you see where you've already lasered, and then you just continue the 360-degree line around the periphery. Case 4 is a large horseshoe tear in the retinal periphery. It's so far in the periphery that the anterior parts of the tear are not visible during photography, color fundus photography with the Optos system. So you can imagine it's quite far away. With the Navilas system, that's something that I do quite often, is that I do it in 2 times. So here we have 2 tears. The first one, the one above, and the second one I just went around the posterior part of the tear, and then I made a new picture. I filled the spaces where I felt like there was not enough laser done, and I went under the anterior section of the tear. And here we see the results. Here with the Optos imaging not quite as visible, but during clinical examination we could see that there were spots also on the anterior part of the tear. So let's wrap up with the take-home messages. First, there is a very high degree of patient satisfaction, especially with contactless laser treatment, as they don't feel any pain, don't feel big discomfort, especially if they compare to the conventional laser. They all prefer the Navilas system. For the operator, it's very safe to use. If you get used to it, it's time-saving in daily clinical practice, especially as you have all the documentation already done. If you have large tears, it goes as fast as if you have smaller lesions. That was our experience with the Navilas system. Thank you for your attention, and now follows a short segment where we demonstrated the Navilas system during AAD in Düsseldorf in 2026. I give some small tips on how to use it. It was used during training mode, so we did not perform any real laser. But this training mode is also quite interesting if you want to demonstrate it to students or residents, because it's safe and does not deliver any laser treatment.
Und dann kann ich einfach schon loslegen. Dann sage ich dem Patienten,
I tell the patient that I'll deliver a few test shots to check whether the energy is sufficient. Usually the first spots appear quickly. Then I take another image to see whether there is visible uptake.
Dann kommen die Herde auch schon. Und dann sage ich,
if they respond well, I continue the treatment.
Genau auf die Stelle schauen.
I align the camera and the laser follows the treatment plan.
Und es geht durch. Währenddessen kann der Patient
During the procedure, the patient can blink or take a short break. The system resumes the treatment exactly where I left off.
Wieder rein, caution zones sind da, es ist alles.
Back in, the plan with the caution zones appears, and I continue lasering. That's it. All spots are delivered. I take another photo at the end.
Und komm jetzt hier.
I can already reach very far out in the periphery of the retina, even without dilation or any special preparation.
Da kann ich jetzt noch rauszoomen.
You can see how it gets darker here, indicating that we reach the ora serrata. Despite the small pupil and the bright light here at the booth, you can still get surprisingly far out with the Navilas laser. You have to work a little with the patient's gaze and head position, looking up, tilting left or right. With some practice, you'll get the hang of it quite quickly.